Welcome to another episode of the Bleeding Edge of Digital Health. We've got a really exciting show for you here today. We're going to be featuring Rehab Boost, which is a patented AI-powered body recognition platform. We've got Paul Jaure, they're the founder and chief innovation officer, and Jennifer Holmes, the CEO of Rehab Boost. Thanks for joining today, guys.
Thanks for having us.
Thanks for having us.
Yeah. Now this is a first for the show. We've done several AI platforms thus far, but nothing in the musculoskeletal arena. So really excited to hear more about what you guys have going on, and I know the audience will be too. So, Paul, what I usually like to do, to start the show is just have the founder kind of tell a little bit about kind of how this thing came about and a little bit about the platform. Obviously, you've got a lot of experience in this space, having founded a golf company in the space as well. So, tell us a little bit about how this all came about.
Yeah, happy to do so. Thanks so much again. First and foremost, for having us. It's a pleasure. So it all starts with a kid that wanted to be a pro golfer and a father that was pushing really hard.
Oh, there you go.
I grew up in Argentina, and my father, moved our entire family because I was supposed to be the next Tiger Woods, and guess what? That didn't happen.
So what's your handicap now?
Now I don't play much, but I'll still break 80.
There you go.
Yeah, kind of. Yeah.
That's respectful. That's respectable.
I used to be. I think I used to be good or promising, and then I got a scholarship to play here in Miami and at FIU, and after that I thought I led her all 4 years and said this is not for me, Dad. Sorry. And I disappointed him, broke his heart. He was in the golf business as well, so I was in the golf industry for years, into retail. It started, we eventually went into, e-commerce, and I started coding and developing, websites and e-commerce operations for our businesses. And that's how I discovered, a technology that didn't really exist. Now everybody talks about AI. I'm not saying I discovered AI, sorry. It's just that a technology that existed called OCR, optical character recognition, is, identifying pixel locations on a screen and, what's a hand or what's, the branch on this tree behind me and whatnot.
Yeah.
And then that evolved into what today we have as, body recognition technology. We've been humbly pioneering it for over a decade. We've been working on that for golf. We exited that company a couple of years ago. It was called Golf Boost, and we created Rehab Boost. Very, very creative with the names, right? And so the idea for Rehab Boost, you said we're experts in the industry. I'm learning this industry as we go along. That's why I surrounded myself with amazing experts as our CEO, Jennifer Holmes, and a great sales team, a great development team. But that's how Rehab Boost was created.
That's neat. Let's maybe just kind of give us a little insight into the use case around the technology, because that's there's so many technologies out there now, and so much noise around value proposition, and whether that's economic or clinical. Give us a little idea of kind of the use case. What's the problem you guys are trying to solve?
Yeah, of course. I mean, I having mentioned that I come from another industry, and the genesis was a golf lesson, a digital golf lesson without using any devices, right? Just filming a user with, of course, a camera on, no peripherals, basically, no specialized cameras, no wearables, any iPhone or Android phone, and that captures the video. It identifies the body parts, body positions, and it compares them against an ideal model, and that triggers a form of instruction. In the case of golf, it was a golf lesson with rehab, is walking the patient through a rehabilitation process, and correctly with visual and audio cues indicating what positions the patient needs to be at. So the user flow that you're mentioning, as a patient, I always felt very lost. I've been injured. I also played soccer, so I played tennis, so I've been injured. I've had ACL operations, meniscus operations, shoulders, back issues. So I've always been in rehab, and every time I went there, they give me a piece of paper, right? And a piece of paper with the exercises that are probably a photocopy of a photocopy of a photocopy. Who knows where that original is at?
Yeah, so like I told you a while back, I've got one of those taped on the wall in my closet, our walk-in closet. It's been there for years. I don't even remember how to get started with it. So I know
That's
that well.
exactly it. And you have a patient in pain that doesn't want to do the exercise, doesn't even know, because you look at him and you're like, one, do this, do that. I mean, but the therapist just told me and I don't really know what I'm doing. So I thought, what an awesome product would this be if, we utilize our existing platform, our existing technology to guide the user, show them a video. Even that was an innovation at that point.
Right.
Show them a video of how to do it correctly. There's always a loop present on the bottom of how to continue doing it, and you get all of the indications in real time. I thought that was a value proposition, right? The value prop for the patient. But very quickly we discovered that all of that data gets also recorded in real time and available to the clinician at a back end. And now you have, for the first time in the industry, therapists, doctors, any clinician, seeing a back end that details time and date stamps, all of the different mistakes per rep that were made by the patient, and of course compliance and all types of reporting.
Yeah. And obviously, I mean, I got to think that, so many patients go and have these procedures done, in centers of excellence at maybe 3-4 hours from their house. That's probably, was that a component of it as well, of, hey, these patients don't want to drive, even an hour to go to therapy once, twice, 3 times a week. Being able to move that into the home has to be, at least a component of why you guys decided to try to move this forward, right?
Well, ironically,
For
we
sure.
were just in a meeting the other day, and one of the doctors, orthopedic surgeon, said he's got data that shows that patients won't drive more than 3 miles, but they'll drive, 2 hours to have a surgery at a major surgery, with the thought leader. So, where it's really hurting patients is those rural markets, those rural areas where they don't have the choices of clinics, there's not a clinic near them, or even if they did have one on the corner, there is that disconnect then from where they had surgery to then rehab. They don't know if they're progressing, and obviously the surgeon that did the surgery has 0 visibility. So we are kind of that connector, the gate to allow all those patients to be able to do their exercise at home and have that 2-way communication with their clinicians.
Yeah. There's, we all know that there's health equity and health population issues abound in the system, and I think that's probably almost every AI platform that I've talked to. That's a huge component of it, is being able to drive consistency and access across the spectrum. So that doesn't surprise me that that's a big component of it. What I want to, for this technology, for me, the demo was everything. Being able to just kind of see what this thing does and how easy it is to use and how cool it is. But before I do want you to jump into the demo here, but before we do that, just can you describe how easy this thing is to use? Because that's what really struck me, was like, wow, this is just, it's really easy as 1, 2, 3. Can you talk a little bit about how easy it is for the patient to set it up and get started with it and then use it?
Yeah, I mean, Paul, you want me to take that one? I mean, it's
up to you. It's easy.
We set people up all the time, and it just takes like seconds. So,
is it
the beauty of it
app-based?
all is, what?
It's app-based?
Yeah, it's app. Yeah, so mobile-based. So, and it's on any Android or iOS phone. It's in all generations. So even if they have a really old version of the phone, it still works on that. So it's as easy as being able to stand with their therapist, instead of handing them a piece of paper, they're downloading on the back end all the exercises. Then it generates a QR code. The patient just puts this phone right up to the QR code, and instantly the app loads right on their phone. They don't have to go to the app store. And when they go in and they just set up their login information, all their exercises are already there.
Wow.
So even in the instantaneous, like if they forgot an exercise, while their patient's even loading the app, and the therapist says, "Oh, I want to add one more exercise," the exercise immediately loads, and then the patient sees it. Or
if the patient says, "This one gives me pain," or whatever, then they just pull that out and put a new one in.
And alerts the therapist that this is just excruciating pain, I can't do it. what it immediately tells the therapist, so the therapist can go alter the treatment plan while the patient's at home.
Wow.
It also has telemedicine built in, so remote monitoring, telehealth. It allows the patients to communicate, set up a telehealth visit. It allows the clinicians to set that up. So all of that is already built into the app itself. So it just makes it super user friendly, but it's always alerting and providing feedback on the dashboards on the back end for the therapist.
Oh, that's great. Yeah, let's jump into it. Let's see the demo.
We can see Paul doing it.
Yeah, no, of course, I'll jump into the demo. Just want to add, regarding the AI body recognition portion of it, as long as the patient is inside the camera view, we can detect the body positions. But it was funny because many years ago with the golf product, our biggest pain point was, how will people understand, or the challenge was, will people understand that placing a phone in front of them, how do they film themselves? It was a real challenge. But now, thanks to our friends at TikTok and Instagram, and all the apps, the future generation especially knows exactly where to stand to film themselves and perform activity.
Isn't that the truth? Everybody's got a selfie stick or some sort
Everybody
of
knows exactly
accessory.
Where to stand and how to film themselves.
That's great. No, and to that point, it's, as we all know, timing is everything with a startup. You could have the best product. If this product would have come out 10 years ago, the infrastructure, the bandwidth might not have been there. People might not have been as familiar with utilizing these types of technologies. So, it seems like you guys threaded the needle from a timing perspective perfectly.
Well, the interesting thing you say that too is the win was behind our sale at the beginning of last year, because Medicare put out 5 new remote monitoring codes that are additional revenue opportunities for the therapy community that they never had before, to push home health.
Yeah.
So virtual home programs, and incentivize the therapy community to stand those up so they can serve those communities, especially, again, the rural communities, right? Because those patients don't come back. I mean, I think we shared with you the data. 70% of patients that start a rehab program don't ever come back, even though they've got authorization by their insurance provider. They just don't finish it.
It's not a monetary thing for them either. It's just a convenience or whatever. But
Well, there's a lot of different reasons. One, I can name about 4 of them, but one, high deductible plans. They didn't have a ride. They couldn't take that time off of work. I mean, my daughter lives in Chicago and hurt her shoulder and just couldn't get there. It just was too much. I can't leave work all this 3 times a week. I can't go across Chicago and go to my therapist because it just takes up almost half of my day. So there's all different kinds of reasons, but it's pretty significant.
Yeah, life gets in the way, right? I mean, when you have, family and kids and jobs and all that stuff, I mean, it's like, do you take your kid to basketball practice or do you go to physical therapy? You start making decisions. So no, I totally get it. Let's see. Let's have you run the demo, and then we can kind of get into some questions after that.
Let me set it up. I'm not proud to say it, but I was one of those 7 out of 10 that didn't do the rehab. And then I go to the therapist and they ask me, did you do it? And of course I said yes.
Right.
Now they can. Now I can't do that because they're going to say, wait, I didn't see you.
Yeah.
Here it is. It's a quick video of how to perform, how to do it, basically how this works. You place the device in any convenient location.
I like the music.
So obviously the camera detects you as long as you're within the camera view.
You're good to go.
It's detecting your body positions, and there it is. And those are real graphs of the app in use. Notice at the bottom you have a loop of how to perform it correctly. Obviously it says don't get too close to one side or the other. One thing it does, if you do it wrong, you see how it turns red, and there's also an audio cue that says don't turn to the left, don't turn to the right, your shoulders are above, don't go past shoulder level. All types of cues that are already pre-programmed. It can be on a table, of course, it can be on the floor.
Look at that. That's amazing.
And then another thing, we can also
Paul, what happens if
mirror it to a screen? So if you want to have a more convenient location, you just mirror it to your screen. And
Yeah,
there you
you put
go.
up on your
How cool is
TVs.
that? So you don't have to, if you want to be further away, you can see it on the big screen and not have to look on the small iPhone screen or whatever.
Right.
What happens if like the patient's doing something and they've got pain, or this hurts or that hurt?
It alerts, it'll stop the exercise and it'll ask for the feedback, and the patient just slides. It's so easy with these different smiley emojis of how excruciating that pain is, of scale of like 1 to 10. And that immediately shows up on the therapist's dashboard, and it's all color coded. So red, they didn't do it, they stopped, they had pain. Yellow, we got to watch them, or green, they're good.
That, and the in terms of the AI component of this, Paul, can you talk to a little bit about the functionality of the algorithm and whatnot?
Yeah, of course. We've had to update the algorithm, the original platform, several times because, of course, the real-time component, the original algorithms would upload a video. We would run what's called an orchestra in order to have scalability, turning servers on and off according to demand. Because one analysis was very heavy and would require servers to go on and off and perform the activity at a server location. Now we do it all real time, locally in the mobile device, which is fascinating. And we have our own CNNs, convolutional neural networks. We're constantly training those algorithms to detect more and more parts. Each exercise requires a ton of development because every exercise has different detection points, a different ideal model, and a different set of instructions. But it's always being updated. It's fascinating how technology keeps evolving.
Yeah. So as that technology is getting smarter, and as you guys are augmenting that technology with additional components to the algorithm, I mean, I see a ton of applications for this outside of just MSK, musculoskeletal. I mean, have you guys looked at that? Are you guys looking at like stroke rehab? I do a lot of work with stroke companies.
Cardiac rehab, all the exercises for cardiac rehab are already in the app. We've had a lot of those discussions, so I think it's got a lot of opportunity to expand. Occupational therapy, we haven't gone to that level yet, but that's a goal for us, is to add hands or very, more detail. But yeah, and I think on the cardiac rehab space, again, that's a huge issue. 80% of patients don't go to their cardiac rehab programs, and there's a lot of education that's required, and a lot of effort to do virtual home care, and there's a lot of looking at that from a CMS and the payer side, because that's a very expensive proposition for those patients. So
yeah.
We've had several conversations just recently, actually.
Yeah. So and a lot of what you hear providers say about technologies like this is how is this gonna sync up with our workflow internally? How is this gonna walk us through how let's say I'm a patient, I do half the platform or half of my program today, tomorrow I miss. How does all of that work through on the back end with the provider system, and how do they get alerted to, hey, Mike's not compliant, or hey, you might want to give Mike a nudge? Does it automatically sync up with their platforms and all that?
Yeah, I mean, that's what I mean. It's like it has the right next to the patient's name, it's color coded. So if they never even logged into their app and did anything, it would turn that little the dot next to the patient's name red, basically, right? So then the therapist knows, I need to go in and see what's going on, and they'll know immediately, because everything is time and date stamped, everything is real time, so they will know, okay, this patient didn't even go in and do the exercise, didn't even log in. So they can see all of that. They can also see they reported pain, they saw time and date stamped of how many reps did they do, and then they stopped the exercise. All of that detail is in there. And from a provider's side, going towards the insurance, all of the time and date stamp reporting, they can just literally pull that data right out in real time and submit it directly to the insurance companies and directly to CMS.
Wow.
So all the reports are there.
I just want to add that you also, have communication, obviously, from the therapist per exercise, also globally. If an exercise was missed, There's all types of automated communications as well. If you don't show up, if you're not doing your rehab for the 48 hours, we're not annoying, but we are persistent. So if you don't do your exercise, says, hey, a day went by or 2 days went by that you didn't do your exercise. If a therapist prescribes a new exercise or changes something in the treatment plan, immediately the patient also receives alerts, push notifications constantly. An exercise has been updated from all the way to you've been discharged. So, and there's a continuation of that patient cycle as well throughout their life cycle. But
you'll get an alert on your phone that says, "Hey, Jennifer, you haven't been doing your exercise.
Get to work."
For the last week." I'm like, "What?"
Yeah, right.
Yeah,
When I first came,
we're not annoying,
I'm like, it's
but
talking
yes, we
to
are.
me.
Yeah, no, I mean, but that's that's great. And like a doctor or a therapist, if a patient misses 3 meetings, they probably don't have alerts on their internal system to say, "Hey, Jennifer's not being compliant. Jennifer just misses."
No.
There's no catch-all
There's
to
no
manage that.
visibility.
Yeah, there's no to manage
Exactly.
the holistic perspective of that patient.
Well, and the attrition rates are very high, and they're getting worse and worse. But I think that's the beauty of this too, is it allows them to say, okay, why are we losing these patients? And let's keep them more engaged. So therefore, if we know they aren't doing it, we can reach out and do, hey, don't forget about your appointment. Hey, can we set up a telehealth call so that we can make sure you're okay with your exercise program? If you can't come back in and they do that remote monitoring, now they can bill for it. Otherwise, they just lose that revenue altogether.
Yeah.
Yeah.
So attrition
When
equals loss of revenue.
So
When we
go ahead, Paul.
No, please.
No, go ahead.
Okay, no, I was going to say when we set out to define the architecture, the roadmap for the product, we never envisioned the power of that robust backend that's built right now. I mean, I never understood it. First of all, the need for compliance from the clinicians and all of that reporting that goes on and all of the functions from one-click assignments where we are very efficient with their time management. We don't want to interrupt their workflow. We understand they're very busy. So when we come into a clinic, the idea is that nothing changes. As a matter of fact, we make it much better for their time to be more efficient, because with one click, you have an entire treatment or program, what we call rehabilitation program, with different phases for different weeks. You can go all the way to the next 6 months with one click. So you have phase 1, 2, 3, all the way through different phases that the patient keeps evolving through the treatment plan. But yeah, all of, from even range of motion, we never envisioned range of motion being a part of the platform as well. So yeah, we're very proud of that back end as well.
Yeah, no, these the market for MSK is exploding. I mean, yeah, Jennifer, you had some statistics on that. There was a couple statistics you shared in the call previously that were...
Yeah, I mean, it's 1 in 6. Well, from an employer side, it's like $600 billion on their self-insured plans. And what we just
That's
learned
incredible.
from one of our advisory board members, who was the former CEO of United Healthcare, was saying, this problem is just getting exacerbated because now almost anybody that's got 50 or more employees is a self-insured employer. And so if they take on those expenses for, back, shoulder, neck, if it's chronic and you go in to do a job and they don't even know if you can do the job, but then you get hurt. I mean, there's just so much spend around that.
Yeah.
Lost days of work, huge worker comp claims. And so there's a lot of effort right now to try to mitigate the risk, understanding that up front, making sure the patient has the ability to even do the job. If you think about Amazon or UPS, they have to pick boxes up and all that. So I think there's just an enormous amount of effort there. It's the 3rd largest spend in all healthcare is musculoskeletal.
That was the one that blew my mind when you said that.
As the aging population, it's getting worse, right?
Yeah. That was the one that I had no clue that MSK was the 3rd largest spend. That's an incredible statistic. Would you consider this kind of an adjunctive therapy to in-office treatment at this point? I mean, I personally think this is I would be surprised if the market doesn't move to this significantly, if not exclusively, moving forward. People just aren't going to. If people find out that this is an option, they're not going to want to come into the office. But is this an adjunctive therapy at this point?
Our whole is we're not circumventing the therapy community. I think you've got to have both. And I'll give you a real-time example. My mom just had a total knee reconstructive surgery, 3 weeks ago? You knew that. And so there's just no way she would be able to rehab at home and not have the relationship with her therapist, which has been a great experience. But, she's 83.
Right.
So she has our app. And she can do the exercises at home, which, the certain things that they want to do while they're in bed, to when now they're getting up and moving them the day of surgery. But for us, we should be an extension to continuing to do those exercises at home that they did at the clinic, just so my mom gets her range of motion back faster, is up walking and gets back. She's a real estate agent at 83.
Wow.
So she's, and she's very motivated.
Yeah.
But the thing I was telling Paul, the wow factor for me on this is, but think about how many of those patients don't have family members that can drive her to therapy 3 times a week.
Right.
I mean, I was doing that while I was there, and my sister's there. So I guess my point is it's a combination of both. Yeah. I don't believe we'll circumvent the therapy community. I really don't. I think there are certain subsets of patients that will do really well with home-based programs, like our minimally invasive knee reconstruction or shoulder, so you don't get frozen shoulder and you're doing your range of motion and you're doing them well. The other feedback is to know you're doing it right and you're progressing. Right. So we'd be able to give you reports on how well you're doing and how each week you're progressing, your range of motion is getting better and better. All of that's in the back end, and also for the patient to see how well they're doing. So I think it's both. But I think this is it's part and parcel to the larger trend that we're seeing in healthcare of moving from the acute care setting to the home, right? Like maybe in the future, patients like your mom will go and have a month of in-office therapy, but then they can move to this once they get some mobility back and they are able to do this from home. Then so you're right. It's probably going to be a very complementary tool. You touched on, Jennifer, reimbursement a little bit in some of these, the new telecodes that came up. Share with the audience, like, how does this get paid for? Does this work under the existing reimbursement codes plus, add-on codes, or how does that all work? There are new codes. So from a Medicare perspective, they're new codes. So it's a 20-minute phone call following, a follow-up. So there are different metrics that they use. Like sometimes if you hold on a patient within the first 30 days, if you do a 20-minute call and then you follow up at 30 days, you can bill for 2 different codes. So it's just going to be dependent on how clinics set the programs up. But more important, on the MSK side, on the employer side, if an employer starts using Rehab Boost, for example, and they start seeing better engagement with their employees, higher compliance, and they go to the insurance provider, and we've been told this by multiple insurance executives, that they will pay for the reimbursement for Rehab Boost because they want to have those patients more engaged, more proactive, trying to get back to work faster, trying not to get hurt again because they didn't rehab and then they got hurt again, or they hurt their shoulder but their knee, all that happens at work, to mitigate the worker comp claims. It's such a massive expense, right?
Yeah, that doesn't surprise me that the payers would jump on this. I mean, if you can get people back to work, minimize re-injury, I call them the Obamacare initiatives, right? Like, value-based care, early diagnosis, lower readmissions, all of those value-based propositions. The payers they're realizing that, it's, you give $1, you get 10 back, or there's a ratio to that where there are tangible return on investment. Where are you guys at? I want to be sensitive to time here, but one question that's always near and dear to my heart is being a sales guy is where are you guys at from in terms of launching it and commercialization and whatnot?
We are ready to go now. So we've worked really hard for the last several years and brought on an amazing sales team and some people that you probably know that got great relationships and are seasoned, and we're ready to go now. So we've got a lot of great activity and gotten some really good news this past week. So yeah, we're ready to go. Got a lot of interest.
And
pipeline's growing.
Yeah. And what's the, like, initially, who's the target? I mean, are you going after, obviously it sounds like you're talking to the payers, but also are you going after, institutions with big, orthopedic programs or community hospitals or all of the above?
We're going to the hospitals, the clinics. We're working with an organization that works directly with the employers and self-insured plans. So they're out there and they're growing rapidly. Yeah. So in partnership with them, they'll use the Rehab Boost app as part of their solution for virtual home care and working with the large employers. There's 38,800 clinics out there. There's 6,200 hospitals. There's plenty of space for a lot of players, but that's going to be our focus, is to focus on the clinics and work with them. Yeah. And the hospitals that own their therapy clinics and own their practices.
Right. Yeah, if they're vertically integrated, that makes perfectly good sense. Well, listen, guys, I want to get you out of here on time, but I just wanted to say thank you again. I know this will be an episode that will be very, very well received by the audience. This is one of the cooler technologies we featured thus far, and really appreciate you guys taking the time to come on. And maybe we can get you guys back on here in a year or so, and we can do a reloop on it and see where you guys are at. But wishing you continued success, especially with the commercial launch. Be excited to hear what's going on out there, and don't be strangers. All right.
Yeah. Well, thank you. Yeah. We're looking forward to it.
Thank you so much, man. Really appreciate it.
Of course. Well, that's it for this episode, folks. Look forward to catching you on the next one, and appreciate you tuning in.